Amar, thank you. Thank you for being here. Love the panel. Great show at the conference. It's, I think, important for people to understand that the biggest impact for AI is going to be the healthcare space. Healthcare has always leveraged technology to make life better, not only for the physicians and the hundreds and thousands of healthcare workers, but more importantly, for the patients who are receiving that care. And that keeps evolving. It's good to learn from you how you think the space is shaping up and how technology is trying to influence and make things better for people.
Sure. Thanks for having me, and really appreciate being here at the IIT Leadership Conference here in the Bay Area. I think it's a great question you asked. I'm going to challenge the premise of the question a bit. I think we often have used technology with the best of intentions to improve, as you're mentioning, care for our patients. The way that we deliver care, the effectiveness, our ability to connect all the data. Though, as you saw with EHR implementations over the last 10, 15 years, the great part about EHR implementations is that a lot of the data got connected. Meaning if you were within the same system and someone went to see the cardiologist and another person went to go see the rheumatologist, that information was seamlessly able to be read within the same chart. However, one of the unfortunate burdens that came with that was that it made and worsened the interaction between the patient and the physician. Oftentimes we see physicians looking at their computer screen and typing away as the patient's in the room, as you may be in the room talking to them, and not getting as much face time with the patient, of eye contact, really listening to their story and really listening to what's going on. And they may seem like they're distracted. The good opportunities that exist now with technology and AI, and one area that there's a lot of excitement around, is ambient listening technology, where you can put a microphone in the room, like you're doing right now. It can record our entire conversation, and it can come up with a summation, a note of the visit. And it would allow a physician and a patient to sit there and have a conversation like they may have had 30, 40 years ago. So I've been sort of using this catchphrase, and you may have heard me on stage saying this, that old is new again, right? That the new technological evolution that we're going to see will ideally allow us to return to those critical patient-physician interactions and make them more human and bring the care back into that interaction rather than just the documentation load and trying to process a lot of paperwork.
The other thing I want to ask you is trying to understand the startups and the bigger companies who then leverage this technology to build products for your industry. How do you look at that, and is there a space where you get involved trying to tell them what the needs are and how they should make this better?
Sure. So I like to think about this question for the startups as the who, the how, and the what question. The who question is, who's on your team? Who founded your company, and who are the team members supporting? Oftentimes we think that healthcare can, quote unquote, be disrupted. It's, quote, prime for disruption, and that is very true. The one challenge I think that folks don't always appreciate or realize is that there isn't a playbook that you can take for one industry and plop it into healthcare that it can work. We've seen a lot of the biggest of companies tried and unfortunately failed. We've seen JP Morgan, Amazon, and Berkshire Hathaway come together for an enterprise approach, and it didn't work. We've seen Walgreens pulling out a lot from the healthcare sector. We're seeing even CVS starting to pull back from delivering care as well. And what you tend to see is that it's very complicated to enter. And so when I think about the who, it's really important that there's someone with clinical expertise, with a clinical understanding of what's actually happening in the ambulatory clinics, what's happening on the floors of the hospital, what's happening in the ED, to understand those problems and to be able to communicate with the staff, be able to communicate with the leaders who are leading and acting within the health system. So that's the who. The how question is, how do you plan on implementing this and bringing this to our organization? As you may have heard during the talk, practically all major hospitals now have electronic health records. They're run on three primary systems, really two if you look at it, and it's called Epic and Cerner. Epic is really the dominant player. We've all invested, particularly if you're a large system, hundreds of millions, if not in some cases billions of dollars into this enterprise software. So how you integrate with that software and integrate with that platform, how you build upon what those offerings are extremely critical. In a vacuum, your solution for me in the ED may be the best solution. However, it doesn't integrate well, it doesn't fit seamlessly with what my technology offerings are with my electronic health record, it probably is not going to be a good solution for me. Lastly, it's the what. What are you offering me? Are what you offering me better than what I have today? Okay, perhaps the answer is yes. How much better is that than what I currently have and what another solution may offer? And the reason the what is so important is that the how is really important too, right? I then have to manage potentially another software. My IT team potentially has to manage another software as well. And so it adds complexity to our environment. So it really needs to have a big delta for it to make sense with us.
I think you gave a very good answer for especially the startups to look at how things evolve and how they're absorbed in this huge ecosystem. Amar, thank you for being here and sharing your thoughts with us.
Thank you for having me. I appreciate it.